Good evening. Today is day 12th live and day 13th. We have been posting questions in our Telegram channel. Yesterday we couldn't do live because there was some issue with my internet, but today here we are. I'm Dr. Amant Polu. I'm a physician based in Abu Dhabi and I'm founder of Medaffin ecosystem. Medaffin Academy is part of Medaffin ecosystem, and Academy is designed for MBBS students and NEET PG aspirants for their preparation. Okay, so we have a channel. It is called Medaffin Academy, and what we do every day in our channel is we post around 20 to 20 questions MCQs per day, which are from NEET PG, and these are high value questions, right? And we start at 8 a.m. Every 30 minutes we post question. At 5:30 p.m. we will post our last question, and you will have 7:30 p.m. Time till 7:30 p.m. to select your answers. And what we suggest is you can just wait till 5:30 or 6 o'clock. Just come randomly at 5:30 to 6:30 or 7 and select all the questions, and you can be a participant even then. So we do have good participants. Like, we have only 60 subscribers, but people do vote. Like 8 to 10 people will vote, and people will also, the NEET PG aspirants will also get a full PDF question and answers with explanation for all the questions which are posted in that day. Let's say today we have posted 20 questions. At the end of the session, this live stream at 10 p.m., we will send a full PDF with questions, answers, and explanations. And we have been doing this for past 12 days. You can see August 7th, August 6th, right? So if you go to the polls, we have almost like 264 polls, which are nothing but the MCQs. So we intend to post more questions in coming 20 days, because we have only 20 days. And if you want to be part of our channel, just scan this QR code, which is visible on the screen. Or hi Shravan, scan this QR code, or you can just click on the link. Hi Shravan, how are you? Click on this link, then you will be straightforward coming into our YouTube, our Telegram channel. If you are not a subscriber to my YouTube channel, please, I request you to subscribe to this YouTube channel. Give it a like, share, so that it will be spread among all the MBBS graduates or medical healthcare professionals who are preparing for some courses. Yes, I'm also sharing the YouTube live link in the chat. So if somebody wants to join, or you want to send it to anyone, you can just send it. Okay. So that's how we are doing. Like, every day we post 20 questions. We don't sell any products. We don't advertise. We just post questions. This is done to make sure that NEET PG aspirants who are giving for 30th August will be benefited in some or other way. It is kind of revision for you, right? Okay. Without further ado, let's begin today's session. What I will do here is I'll just uh, describe the question and options, and what percentage has given the answer correctly and what percentage has given the answer wrongly. I will not explain the full explanation because it will take more time. So what we are doing is, like I said, we will share the full explanation as a PDF. So for the sake of this, I can show you this is how the PDF will look. Full explanations and answers for each questions we are sharing here, right? So let's go to the first question today posted. A 6-month-old child presented with diarrhea and vomiting for 3 days. Which of the following enterotoxins is most likely responsible for the condition? Okay. Out of which 37% has given their answer as NSP4, 50% as NSP6, 13% as VP3, and 0% as VP7. And the correct answer is NSP4. Only 37% has given their answer as NSP4. Like I said, full explanation will be provided as a PDF at the end of the session at exactly 10 p.m. So if you want to join, just scan this QR code, or you can just click on the link. You will be part of our channel. Next question is, steps in case control studies include multiple response types. These are multiple response types. Uh, the first one is follow up, second one is matching, and the third one is selection or allocation, fourth one is inference of resultant data. Okay, so which of the following are actually part of case control study? So according to the options, we have 2 3, only 1 2 3 4, 1 2 and 2 3 4, out of which 66% has given 2 3 4, that is matching, selection and allocation, inference of resulting data. Okay, inference of result data, that's the correct answer. And almost 34% has given their answer as option B and option C. Okay, the correct answer will be shared in the PDF at around 10 p.m. exactly. So if you want to get hold of that PDF, or for future questions, just be part of our Telegram channel. Coming to the next question, choose the structure marked. Okay, so if I just click on it, exactly it is asking this area, what is the structure in anatomy of eyeball, right? So we have 17% selection selected as Eggers line, and 0% lens capsule, 17% as canal of Hanover, and 66% has selected the answer as canal of Petit. Okay, the correct answer is canal of Petit. And so we can say, like, these are the tricky questions, right? Like, if people are answering these questions wrong, it means these questions has to be given some form of attention. Coming to the next question, it's an image based question. It is a 55-year-old man presents with hematuria, and a mass is seen in the left kidney on CT scan as shown above. Okay, there is a mass. This is a kidney, right? Left kidney. Okay, what is the diagnosis? Okay, coming to the four answer options, 14% has given their answer as renal angiomyolipoma, 14% has oncocytoma, sorry, renal oncocytoma, and 72% has given their answer as renal cell carcinoma. The correct answer is renal cell carcinoma. Okay, yeah. Coming to the next question, again another image based question. You can see, like, not dislocated, sorry, displaced fracture. And the question is, a patient presents to emergency departments after he fell on his outstretched hand. An X-ray was performed and is given above. What is the diagnosis? Okay, we have four options: Colles fractures, Rolando's fracture, Gallagher fracture, and Monteggia fracture. Out of which 75% has selected their answer as Gallagher fracture, and 12% as Colles fracture, and 12% as Monteggia fracture. Okay, the correct answer is Gallagher fracture. Okay. Yeah. Coming to the next question, a patient presented to the emergency department with aqueous flare and KPs. Okay, his intraocular pressure was elevated. Which anti-glaucoma drug must be avoided in this patient? Okay, so must be avoided, not given. Okay, this is the one important thing. Like, whenever you read a question, just understand it, wait and analyze, and after that, answer it. So even though subject, sometimes it can be accept true, false, something like that in the question. The 75% has given their answer as PG analogs, that should be avoided. 12% as beta blockers, 12% as carbonic anhydrase inhibitors. And the correct answer is PG analogs should not be given in this particular case. Okay, coming to the next question, it's a histopathological slide. The cells marked in this image given below is above will be involved in inhibition of following structure. Okay, will be involved in the inhibition of following structure. Okay, the correct four options: vestibular nuclei, lenticular nuclei, deep cerebellar nuclei, anterior horn cells of the spinal cord. And the correct answer is deep cerebellar nuclei. So if you are liking this, please be part of our YouTube channel. Subscribe to my YouTube channel. Give it a like, thumbs up, and also please, if you are a medical student or NEET PG aspirant, scan this QR code and be part of our Telegram channel. We are growing, and we are planning to grow very big. Next question is a 30-year-old woman presented with painful blisters on skin and oral mucosa. Direct immunofluorescence is given below. Okay, which of the following is false regarding the same? Okay, we have like zero. First option is antibodies against desmoglin 3. Okay, antibodies against desmoglin 1. Suprabasal acantholytic blister is a characteristic feature. Antibodies against hemidesmosomes. Okay, which of the following is false? This is actually the correct. Read the full question. It's false. So antibodies against hemidesmosomes is the false statement, and all the three other statements are correct statements. Okay. Coming to the next question, high thermic effect is seen in. We have four options: carbohydrate diet, protein diet, fat diet, vitamin diet. In that, protein diet is the correct answer. Only 50% has given their answer as protein diet. Protein diet has high thermic effect, highest thermic effect. Coming to the next question, a patient who is known used a known case of fibroid uterus presents with acute abdomen, fever and leukocytosis in 24th week of gestation. Okay, what is the most likely diagnosis? And the correct answer is red degeneration pregnancy. Only 67% has given the answer correctly, and almost 33% has given other answers are torsion, infection, preterm labor. Okay, so almost all the four options are selected. I mean, I think this is one of the important question, and it is easy. Like they already mentioned it's a known case of fibroid uterus and 24th week of pregnancy with fever, leukocytosis. It's a red degeneration is common cause, because during pregnancy the circulation to center of fibroid will become compromised, resulting in necrosis and red degeneration. Coming to the next question, what is the procedure being performed in the MEH? It's a simple direct question. It's a tracheostomy, and everybody has given correct answer. So we are posting about 7 to 8 image based question out of this 20. We are expecting around 25%, 20 to 25% in this exam as image and video based questions. So that will be somewhere around 36 to 45 questions will be image and video based questions, right? Video based questions, speculation is there that we will have video based questions. So we also introduced a video based question. Currently we are doing only one video based question per day, but that itself is like 30 to 40 questions, but we will be providing a video based question module in coming weeks. So we are planning, we are just preparing so that it will be ready. Coming to the next question, a 24-year-old man met with an RTA and was brought to casualty after 6 hours. His BP was 90 by 60, heart rate was 110, and SpO2 was 92%. A blood transfusion was done. A few hours later, the patient is febrile, tachypneic, and starts bleeding from IV and NG sites. His SpO2 level started falling. What could be the cause? Okay. Out of the four options, 71% has given transfusion reaction, and 29% has given the answer as fat embolism. And the correct answer is transfusion reaction. Okay. The other options are acute adrenal crisis and hemorrhagic shock. And the correct answer is transfusion reaction. Coming to the next question, an IT employee who has recently taken up the job is feeling guilty, hopeless, and not able to concentrate on work. His symptoms started 3 years back when he started college. The most likely diagnosis is, okay, the four options we have: depression, dysthymia, adjustment disorder, and cyclothymia. Okay, and the correct answer is dysthymia. Only 57% has given correct answer, and almost the other options are like wrong answers are about 43%. So it means it's a whenever it is around like 60%, right, it means like it's a slightly tough question, and we need to concentrate more on these questions. Which of the following statements is incorrect? That's the statement, right? Incorrect. Mode is the mode is for the qualitative data. Mean is affected by extreme. Mode is least affected by extreme values. Okay. Median absolute deviation MAD isn't measure of variability of a univariate sample of quantitative data. Okay. So out of this, what is the incorrect statement? Incorrect statement is fourth, and almost 80% has given correct answer. It means it's an easy question. So all the three statements, other three statements are correct. Coming to the next question, this is an ECG. Okay, so that's what, like, if you can see, like, we are providing almost very good image based questions, ECGs, slides, you know um, various image based questions, sometimes parasites and all those stuff. So if you want to be part of our Telegram channel, just scan this QR code or click on the live Telegram link, which is pasted in the live chat. I will paste it again. Just click on it and you will be part of our Telegram channel. And spread the word. Like, this is completely done. We are not selling anything. We are not advertising. It is purely MCQs, and you can you can see it, like, till now we didn't do any advertisement. We are not intending to do any advertisement, for this NEET PG 2026. We just want to contribute more to your preparation. This is the ECG, and the question is: a 63-year-old male is brought to casualty in an unconscious state. Okay, BP is measured 70 by 50. It means low BP, and ECG is shown below. What is the next step in this line of treatment? Okay, if you see the ECG, he is actually SVT. He is in SVT. Okay, supraventricular tachycardia. And the catch here is 70 by 50. His blood pressure is down. It means he is unstable SVT. And the correct answer is DC conversion. Almost everyone has given correct answer, and that's a very good thing, right? So the treatment protocol everyone follows. If it is a stable patient, then the correct answer is hi Amrita. If it is a stable patient, if the correct answer is IV adenosine. Okay. Coming to the next question, orthopedic injuries are most common injuries presenting in surgical emergencies. Okay, these injuries can create visible deformity. One such deformity is fishtail deformity in any child. Which of the following is most likely cause if the child presents with a fishtail injury? Okay, which of the following is most likely cause? Okay, and the correct, almost 60% has given correct answer, 40% wrong answer, right? Distal tibia, distal femur, distal humerus. Correct answer is distal humerus. Coming to the next question, it's an image based question from community medicine. Please observe the provided image and choose the linear regression equation that matches the displayed graph. Okay, we have on x-axis 0 to 8, and we have on y-axis uh, at in intervals of 5, 10, 15, 20, and 25. And this is the linear regression. They want us to choose the really linear regression equation that suits exactly this graph. Okay, 25% has given y equal to 10 minus x. Okay, 0% has x equal to 10 plus y, and 75% has given y is equal to 11 plus 2x. Okay, y is equal to 11 plus 2x. That's the correct answer. Okay, how they got into this particular thing, you have to just look. I'll give you one example. This is y 15 and this is x, right? So 11 plus 2x, 11 plus 2 into 2 is 4. So 4 plus 11 is 15. So the point at which the both x and y are meeting at this particular point is actually the rough calculation is around 11 into 2x. Okay, and it is the same for everything. Okay, Coming to the next question, full explanation will be given in the PDF. If you want to be, if you will be part of this channel, you will get the PDF access at 10 p.m. exactly. We do the same thing every day. We post questions, we do live, and we do post the explanations at end of the day at around 10. Coming to the next question, again it's image based question. We have 1 2 3. Okay, a patient with HbA2 of 3% and HbF of 97%. A peripheral blood smear is taken. Which of the following blood pictures will be seen in this patient? Okay, this is the first blood picture, which is the correct answer. Okay, and answer is 1 and 3. 2 will not be visible in this particular patient with HbA2 adult 3% and HbF 97%. Okay, full explanation will be provided in the PDF at 10 p.m. in the Telegram group. So if you want to be part of Telegram group, just click on the Telegram link which is present in the live chat, or scan this QR code. Coming to the next question, I think we are reaching the end. Which drug is used for trastuzumab resistant HER2 positive breast cancer? Okay, the answer the question is, which drug is used for trastuzumab resistant? It's a resistant variant for HER2 positive. So HER2 positive breast cancer. 50% only has given correct answer, that is lapatinib. Okay, and other questions other options are sorafenib, vemurafenib, and eriotinib. Okay, the correct answer is lapatinib. That is the correct answer. And last question we usually post is video based question. I think you can observe this is a video based question. Okay, a 42-year-old female, let me read it properly. A 42-year-old female undergoes laparoscopic cholecystectomy for symptomatic cholelithiasis. The video displays the critical view of safety, okay, CVS, highlighting a triangular anatomical space bounded by cystic duct laterally, okay, the common hepatic bile duct medially, and which specific vascular anatomy is expected to be found within the diagonal. So they are just asking the boundaries of critical view of safety in laparoscopic surgery. So one thing is actually cystic artery. The other two things are already mentioned here. And the correct answer is cystic artery. See, only 67% has given their answer. It is actually a memory based question. They gave two options and they are asking for which is the third border. So a simple question. Okay. So I think that's it. We have completed our live and we completed it in 26 minutes. Okay. So once again, I would like to inform you, we are doing it for last 13 days and we post every day almost 20 questions, and we are planning to post good materials, video based questions, somewhere around 100 to 150 to 200 video based questions in the group. So if you want to be part of this channel, just scan this QR code. You will be benefited from this channel. Second thing, we are not selling any products. You need not buy anything, nothing from us. Everything will be free. Okay. So just be part of our Telegram channel, be part of our growing community. Subscribe to my YouTube channel. That will definitely encourage me to do a lot of content for medical students, NEET PG aspirants. And like I said, we are building one of the biggest healthcare platforms in the world. Okay, and everything starts with something, right? So Medaffin Academy is one thing which we are passionately doing, and we want to do certain things for our fraternity, medical community, for especially in medical education. Okay, so I request you to be part of our channel and subscribe to my channel and spread the word. Tell just share about this channel so that the more people will be benefited from this particular initiative. So thank you. See you again tomorrow, same time.